What is health research? Health research helps us find new ways to treat and cure diseases. Health research helps all of us live longer, healthier lives. And while we've been able to discover so much, we can still do better. Let me give you an example. Imagine you were looking for something in the dark with a candle. You'd probably find it eventually, but wouldn't it be easier if you had 1,000,000 candles? The same is true for health research. The more data we have, the quicker we can find what we're looking for. Enter the All of Us Research Program. We want to help advance health research by creating a large health resource. How big? 1,000,000 people big. By having access to the data of 1,000,000 people, researchers can discover more about our health, and the possibilities really are endless. Here's where you come in. By sharing information about your lifestyle, environment, and biology, you can help empower the medical research of the future today.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter All of Us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1,000,000 people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1,000,000 people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
The All of Us Research Program is an ambitious effort to gather health information from 1,000,000 or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Good evening. My name is Dr. Cayemite. I'm a social scientist and I've done research. And last week we have moved on just to understand exactly what is research and community-based research. I'm so glad to see so many new faces, and those of you who were here last week. And again, welcome. Today, we are about just to look at a new phase of research or community research with an organization called All of Us. And we did look at last week the functions or the bridge between the genome research and also our community aspect of research. Today, I have two pioneers, two great men, two great researchers and practitioners in the field of medicine. And they're about just to tell us exactly what's going on. Dr. Julien, Dedier, welcome.
Thank you. It's a pleasure to be here.
Dr. Bonnet, welcome.
Thank you.
Friends, it's yours. Why don't you tell us a little bit about yourself and just get to the floor.
My name is Dr. Julien Dedier. I'm very pleased to be here. I am a primary care practitioner at Boston Medical Center, and I also have training in research methods from the Harvard School of Public Health. I'm a co-investigator for the National All of Us Research Program at Boston Medical Center.
Myself is I'm Jean Bonnet. I'm an internist. I more specifically looking at the relationship with culture and medicine. So it's culture matter. In that world where we are 7.3 billion, we cannot no longer do one size fits all medicine. And between what you just heard from Dr. Dedier, the value of going to the personalized individual medicine is a new frontier that they are reaching right now. But nevertheless, culture matter. So today we'll get an opportunity to see both sides, to understand you as a person, as a patient, in all the dimension biopsychosocial entity.
Oh, that's very good. At least you clearly understand that the dimension that exists and the distance that exists between myself and these two. Because as a social researcher in medicine, well, we seem to be two different entities. And I need to understand. I need to seek understanding. Probably I will start with you, Dr. Dedier. So when people are talking about research or probably medicine, and there is a new norm, the new standard of what we call precision research or the individualistic aspect of medicine. Can you elaborate just a little bit on that for us?
Certainly. So precision medicine or individualized medicine is an approach to medical care that takes into account individual characteristics of the patient. And this is in contrast to the prevailing kind of medicine that's practiced today. I don't know if you knew this, but even the medications that are approved based on clinical studies are really only effective in about half of the people that they're used in. And so that means that some medications don't work in certain people, and those same medications may actually harm other people. But the current state of affairs is that we can't predict with certainty who will benefit from a particular medication right now, who will not benefit, and who might be harmed. And there are reasons that this is the case. One of the reasons that we'll be discussing in depth tonight is that the people who participate in research studies that show the benefit of one particular medicine over another often are white. They are often not ethnically diverse participants. And so it's very hard to extrapolate sometimes whether a treatment or a preventive measure that works in a certain group of people works in another group of people. And really only the way that we can know for sure if it works in a particular group of people is if those people are involved in the studies that tested the treatment in the first place. And so ethnicity and race is really only one of many different kinds of variables that cause individuals to differ one from another. Of course, there's age that can differ from one person to another. There is health behavior, such as diet or exercise. There are genetics that differ from one person to another. And all of these variables can determine whether a treatment is effective in one person versus another. And so the field of precision medicine, therefore, seeks to understand all of the different kinds of health influences that influence an individual's health and that may influence the effect of a preventive measure or a treatment on that individual. So this is the future of medicine. And with this kind of individualized knowledge of the person that is before me as a physician or any health provider, I, as a provider, will be able to better determine what medication to choose to treat that individual. A medication that's going to be most effective, a medication that's going to be least likely to cause harm, and a medication that the patient will therefore continue to take and actually get better. And so this is what we're here to discuss.
That's very good. You have
So
something to say?
you, as heard this and Dr. Dedier telling you, this is very fascinating. Very fascinating. For me to trace it well, last week we talked about how they come with medication. Who are tested? 82% are Caucasian who are tested for medication. Is the medication they're going, you say you're not participating, but the medication they're going to use on you regardless. And it just told you a large percentage of those medications cannot be effective equally to everyone. Let's say, for example, we have the one medication very good for kidney protection called ACE inhibitor. Not only the dose we need it higher for blacks is more effective in white, but the side effect is way outrageous in blacks. We get more angioedema, more cough, more this. Just to give you an idea where we are heading in individualized medicine, how that would play a role in our life. But in addition to that bio aspect of medicine that you're going to see by using the genome and understand how that works for that person, not his father, not his other, but the person. We talk about race, ethnicity. They're very good, but this time go a little bit further. We talk about you as a person. But that you is not only the medication, is not only the genome. You are living in a context. Let me take an example. If I ask you who I am, you will describe me as that black man with all the entity, mannerism, cultural for black men. What about if I was born in Russia and raised in Russia? You see the difference? Because my behavior, my culture will be the Russian culture, despite the color of my skin. So you understand the value of this, explain it to you, but I'm trying to tell you all the aspect of it, culture and medicine. But how the practitioner could really vehiculate toward that culture was so diverse. Some group, they say Hispanic, they go by language, but it's a misnomer because the Argentinian is not the Brazilian, is not the Puerto Rican. So every is not only language, culture matter. And to understand that, we have to see the patient in all the dimension of his life. The social, political, all the baggage that person come from, what his past is about. But one more important point. You cannot do it for the patient. You cannot have an effective health promotion program without patient participation. Now, if the patient, because the patient brings in his health belief, let's say for a Haitian, for example, they still go to the theory hot, cold, gas. So there is so many facets that will go in. So we're going to elaborate a bit more in detail when they're in individual medicine, and we would also talk about the value of culture and all this of the triangle, the biopsychosocial entity that of the patient got himself.
I think that's greatly interested, and that's where probably fitting well. And I'm sorry if I ask so many questions, Dr. Dedier and Dr. Bonnet. It's often said that before healthcare, we have people. And definitely people need to interact and participate. How can we talk about that great future of medicine without participation? And what's hindering people to participate?
So let me first outline for you the exceptional opportunity that exists through the All of Us research program for participation, especially participation of those who have been traditionally less likely to participate in research. I don't know if you all understand the principles of the program, but essentially this is a national program that seeks to enroll over 1 million people, that's over 1 million people, in an effort to create new and innovative treatments, to understand the mechanisms of disease better than we do today, and also to produce preventive approaches to disease. And so what we're asking and what we're actively doing in this program is seeking out individuals of diverse backgrounds, all different ethnic groups, rural, urban, young, old, you name it, to participate by giving us information about their health habits, about their medical history, about their medications, also biospecimens that include blood and urine. And this will allow us also then to look at the genetic code that can influence health and disease as well. And we're envisioning over 1 million people pooling this information to create a large resource of information, large enough for us to actually ask questions that will pertain to individual profiles. And this large data set, among the largest that has ever existed, will allow us to ask questions that we could not answer in smaller sets of data. And so we're asking participants from across the country to join and remain in the study for at least 5 years. Among the benefits of this will be that the participants themselves will receive back information about their health profile from the study, information that will be compared to others who enroll in the study. And we believe that this is going to add great benefit for individual health of those people who participate, because it will be information that they will have that can help inform their own health. And of course, there are financial rewards. There's a nominal financial reward to enroll in this study. But the benefit truly is measured in the health advances for communities of color, which have traditionally not been represented in research to the same extent of their percentage of the population even. So this is really what we see as the primary benefit, both to the people who participate, but also to the people who come after them in communities of color and generations to come.
Well, I think this is a once of a lifetime. If you're looking, as I say anteriorly, whatever you use as medication wasn't necessarily shaped and specifically for you. And now they're talking about a new era. You're talking about something specifically for you. But my take on this is participation. And as I repeat again, if you're not educated, if you're not empowered about something, it's unlikely you're going to really be in part of it. As I said, one of the greatest researchers of my country, I don't know if you know about him, but you all repeat him or quote him every day, is Mr. Yo. Yo say everything. Yo write everything. Yo do everything. So this is what we base on. But now, let's go to the scientific data. We have to move to a different setup. Let me tell you what's happened in my community as a clinician. Because we have against that empirism which still really play a great role. Some people say, oh, I'm not taking this because this is what they do, or take this because this is good for what. Recently, I could find out 2 of my patients taking Mabi and Simecontra. Okay? Mabi and Simecontra. As a matter of fact, that leaf Simecontra may work for diabetes, because that person blood sugar, hemoglobin A1C was dropping to 5.6, not on my medication. But I was surprised to find that patient really, GFR, which in the renal function, was above 60, dropping in the 30s. So we have to be very, very careful. It's what culture do to you. People go about this on their health, about this on the home medicine, they're still using it, and not knowing exactly what that's going to do to them, because on the name, because it's natural. Natural work because it got a biological, it got an impact on it, otherwise it won't work. So this time, we had an opportunity to participate, to get a real understanding whatever going to shape and form and going to design for us. So, but I know this cannot achieve without participation. All of us, but also getting the community, we have to go to a different level for people to understand where they are heading right now, so they could participate in the process. So I'm expecting from all of us, from Dr. Julien, how we could get a campaign in the community to talk more about that at their level, so they could understand, so they could participate in the process.
Oh, well said, Dr. Bonnet, and I'm very glad it's not me who has stated what's going on in our community based on what we call cultural medicines or homemade medicine, and that's you. Dr. Dedier, definitely we really want just to see people empowered and just engage in the process for that participation, for that new way of research in medicine. But people remember the long-lasting aspect of the work done in medicine, or specifically in research. And people still thinking about the equity system that must exist in this research. So therefore, as you are part of this, and can you tell us just a little bit about the methodology that exists? You don't have to tell us everything, but I don't want to just start to keep preaching and tell people, well, you know what, this is a good thing. But unfortunately, the methodology might be wrong and lead us out to the same way, the same thing that has happened 80 years ago.
Mm-hmm. So I think what you're referring to is the exploitation of people of color in research.
Yeah.
And we've come a long, long way since Tuskegee, for instance. The All of Us study is very, very interested in, number one, transparency. So, as in most common contemporary research studies, there is a very detailed consent process where people who are considering joining this study learn all about every aspect of the study, both the benefits, the potential benefits of the study, and also the potential risks of the study. And this information is reinforced, and their understanding of it is reinforced in several different ways, and they have an opportunity to ask questions, and only if they feel comfortable joining the study will they then be allowed to join the study. So I think that's one way that we can assure that folks can trust this study. But I think the other way, and this is also a very deliberate thing that was built into the All of Us research program, is that communities of color, and really all stakeholders in the community, are invited to participate, not only as research participants, but also in the planning of the study, also in the conduct of the study. There are research community advisory groups at Boston Medical Center who advise the conduct of the study at Boston Medical Center. And these research advisory groups that consist of community members, et cetera, are really active at every level of governance of the All of Us research program. So these are people who have a vested interest in making sure that there is equity, that there is transparency, that there is honesty in the conduct, and that there is sensitivity of the research program to the needs of all its constituents, people of color and others as well. And so the other, I think, safeguard against abuses is that information will be fed back to participants so they can see exactly what has been collected, they can view their own data. And so I think this relates again to transparency, but this is also different than Tuskegee and some of the other historically devastating examples of abuse and prejudice in research, where the research participants were the source of the data, but they weren't necessarily the recipients of the results. But with the All of Us program, participants will receive their results back. And so I think for me, these are the three primary ways to instill trust. And I think that the other thing that the All of Us study is doing is going out into the community to engage communities of color and other communities as well, to talk with them about what priorities are, to try to establish relationships with them. And the institutions that are hosting the All of Us program, such as Boston Medical Center, are actually doing the same. So I know that the Boston Medical Center is reaching out to communities of color, assisting with priorities that exist in communities of color that may have nothing to do with the All of Us research study. And for this is an act of good faith and a willingness to engage, and I think this will build trust. And I think that trust also goes a long way, but it also helps researchers understand better what the needs of the communities that they work with really are, and helps to strengthen those relationships between the research and the people who participate and provide the information that is so critical for the research to occur.
I'm very happy to your answers, and it's just give me a great sense of where we are going. So as a social activist and also a doctor, so tell me about your side.
I tell you what my concern. Obviously, in that $1 trillion industry, which is medicine, there's nothing more political than medicine. Obviously, this research is running by our money, NIH. But NIH is not necessarily the one who's going to execute it. As we get that million people, as we're shifting to genetic mapping, then we go to the private sector. As we talk about health inequity, how they conceive and where that's going to be shift after we get this data available. So we're going to shift looking at more individualized medicine. Would that be paid by Medicare, Medicaid? Would that be paid for those who cannot afford it? What would be the cost of this when we get there? How are we going to really prevent that health disparity and health inequity we have now, not to make it worse? I don't know if you have the answer, but this is my concern.
Well. I do believe that we have covered so much, and probably we'll leave this section for the next round. If you agree with me.
I'm ready to answer.
You ready to answer? And
save it until the next round.
Oh, okay, then that's good. Friends, just we have heard enough, and make sure that you start thinking about your question. And I know you have lots of questions to ask tonight. And last week I was here and I said, oh my God, my community have a lot of questions just to ask, and they really need an answer. So we are going to take a short break, commercial break, and definitely these two specialists will find ways just to answer your questions. And please bear with us, and we'll be right back.
What is health research? Health research helps us find new ways to treat and cure diseases. Health research helps all of us live longer, healthier lives.
Crazy question.
And while we've been able to discover so much, we can still do better. Let me give you an example. Imagine you were looking for something in the dark with a candle. You'd probably find it eventually, but wouldn't it be easier if you had 1,000,000 candles? The same is true for health research. The more data we have, the quicker we can find what we're looking for. Enter the All of Us Research Program. We want to help advance health research by creating a large health resource. How big? 1,000,000 people big. By having access to the data of 1,000,000 people, researchers can discover more about our health, and the possibilities really are endless. Here's where you come in. By sharing information about your lifestyle, environment, and biology, you can help empower the medical research of the future today.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter All of Us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1,000,000 people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1,000,000 people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare, not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Welcome back. It is true that I didn't want to get involved in the economics of medicines and the social dynamic that exists between these two. But however, Dr. Bonnet recently asked questions, and I really want him just to voice his concern. And I have a short memory, and I forgot completely about the question. Dr. Bonnet, can you repeat, please?
Well, my concern, as I said, was looking at the cost. Because as you know, I say that research been running by NIH, which is the taxpayer money. But medicine is run by private sector. So the cost of genetic mapping, maybe as we do more of this, and so I just really quickly talk to Dr. J, we should become cheaper. And as we go to treat people specifically in general, that will make it cheaper too. More specific, the outcome should be better and hopefully cheaper. But regardless, you cannot move the envelope if you, as people, are not aware of what we're talking about, because the policies are made by people, and you need constituent people who are getting, I say, to participate in the process. Is how we're going to bring the change anyway. So, to me, it's not I'm trying to answer my question, but as you cannot stand the sideline. You have to be participant. You cannot be an observer because it's directly related to you. As we keep doing for our country. I won't talk about that.
Okay, very good. Very good. I understand purely the policy and the politics and the social dynamics of this, but not in medicine. Dr. Dedier, why don't you answer him?
Certainly.
Thank you.
It is true that the NIH is the largest funder of research here in the United States. It is also true that industry does research. But the final common denominator is peer-reviewed research, which is published in journals. And it's on the basis of that funding bodies, that is healthcare funding bodies such as Medicare and Medicaid, decide what treatments they will cover. That is, what treatments they will pay for. So there are many, many examples of privately funded studies that have been published, considered rigorous, and based on information that comes from those studies, Medicare has decided to fund whatever procedure was being tested and shown to be effective. One that's very, very expensive is implanted defibrillators. So defibrillators have very little to do with genetics, but defibrillators are devices that are implanted inside of the chest or the heart that start the heart beating again if the heart stops beating normally. Now, these have been shown to work very, very well and save lives for certain patients. They're very expensive, but because of the studies, some of which were industry-funded studies, some of which were government-funded studies, because those studies showed that they were effective, Medicare has decided to pay for that. So my answer to your question is that even though these research studies are funded by the government, and then perhaps industry gets involved and does studies too, if the published studies from these experiments show that precision medicine X for disease X works very well, then hopefully insurance companies will then fund them. That could be public insurance companies, private insurance companies. Generally, if the public insurance company like Medicare says this should be funded, then private insurers will follow suit and also fund.
So that's a great. You don't have any rebuttal, so I'll hold it for a second. I always tell my students, before we extend to new things, new endeavors, definitely you need to educate yourself. And here we are talking about precision research or individualistic aspect of medicine. And I don't know if the general society understand what's going on. When I understand this is a type of education, but when are we going to do a larger education for the community to get involved and understand it? Why I'm saying that? Because I feel though in the past, we have outsiders come and do research on us. And now I'm looking at both of you as researchers, and it makes sense to me. So do you think that we need a larger education to the community?
I think we absolutely do need larger education initiatives in the community to educate about precision medicine for very many reasons. Number one, precision medicine is the medicine of the future. So in 2015, President Barack Obama announced that it would be the wave of the future in his State of the Union address, announcing the Precision Medicine Initiative on a national level to achieve new treatments, new ways to prevent disease, new ways to understand disease. So I think there is more awareness than ever on the part of the national government and certainly the medical community that precision medicine is important and essential to improve the health of all Americans. And tonight's meeting is just one of many efforts that the All of Us research program is launching to educate the public about precision medicine. It's one of many, and it is going to be an ongoing effort as we meet with communities, as we discuss the benefits of precision medicine, as we discuss and understand the needs of communities and interact with them over the next 10 years that this All of Us research program intends to proceed. So I agree 100% that this is the future of medicine, and education on a large scale is required, and that effort has begun.
I could add more to it. So for those of you who are here quite selective, if I could say it, I try to understand where the future headed, and not participating in the process is like really rob you the chance of the future. Not only that would for treatment, but for prevention, and also would get a better outcome. So this is the key, that's the road to go. But for us, again, we have a duty to educate our people who still, I would say, not only at the old mine, coal, gas theory, not only still at the possibility disease, natural disease versus supernatural, not only are not at the etiological level of disease, because disease for them is symptom, they're not really at pathological level. So we got a long way to go to reach. We are so much behind. So for us who are here tonight, we have a responsibility to get engaged. So see if we could really catch up to some level so our people could benefit from it. So they require everybody's engagement. Engagement at all levels. Let me give you a simple idea what's happened to me. Obviously, as a physician, I was seeing a patient with abdominal pain, just coming from Haiti. Geographic medicine, I think, was parasite. I do this test, the stool study, and it was parasite. I give her medication. I say, I'll see you back in 2 weeks. In 2 weeks, he come back and say, Doc, I cannot take it. My belly is killing me. And I said, did you take my medication? And the answer was, medication? You didn't give me any medication. And I grabbed my note. I said, gee, what's happening? I said, I know I give you medication. He said, I could swear. What you give me is that piece of paper. It's not a laughing matter. This is where we are as a country. What is our responsibility? I come from the countryside. I know better. I should know that. I think I missed since to explain to him all the steps. I'm assuming that way. So what I'm telling you, we are so far behind. We have a responsibility to get engaged. That's the only way our children, grandchildren really will be at the level. Because we are living here in an island close to the mainland with no bridge to the mainland. We have to create that bridge.
Well said, brother. And I understand that. Definitely we're talking about the framework of participation, and your illustrations really prove to us that a lot of work needs to be done in education. And you who are listening to me, we have a lot of work to do. It's not just us, but it's across the board. It's the other people on our side. If each of us are supposed to just have to be responsible for our next door neighbor. And Dr. Dedier, we spoke a lot at large from that framework of all of us. And it will be amazing that if we don't tell these great people, they come here. And they said, some people might say, so what? Some people might say, oh, so what next? Yes, I really want to get engaged. Where should I go?
So there is an app that you can download from the App Store. It's the All of Us app. And once you download that to your cell phone, it will lead you through the process of enrolling in the All of Us study. You can contact the telephone number that we will make available to this studio audience, and I believe also the viewing audience. That information should be made available there as well. If you would like to go online and simply Google All of Us Research Program, you would find the information pertaining to enrollment there as well. So I encourage you to do that and to think about asking others to do the same for all of the reasons that have been discussed here today.
Okay. Permit me if it's not an arrogant question though, because you talk about apps. It sounds just a little bit elitist, because my little cousin or my brother, my grandma, and my parents, they don't know exactly how to operate or to just to navigate or browse to an app. So don't you think that all of us are supposed to do a better work? I just have to find ways to reach out to the elderly populations whom that really want to count on and really want them to participate.
Yes, thank you. As I was actually talking about apps, I had the same thought. So I apologize for that. However, what all of us is also doing is going out into the community, as I mentioned before, and trying to spread the word. We're doing mass mailings to communities, communities of color, including our flyer and all of the contact information that would be on our flyer. So I think there's a lot of outreach that needs to occur, but we would like to enlist your help as well in reaching out to your friends and your neighbors and spreading the word about the All of Us research study.
Friends, it was a pleasure to just to be with you this afternoon, and definitely I'm waiting just to find out exactly about your question. Dr. Dedier, thank you for the opportunity to open up and just present to my community. Bonnet, thank you so very much. We are going down to a short commercial break, and we'll be right back again.
What is health research? Health research helps us find new ways to treat and cure diseases. Health research helps all of us live longer, healthier lives. And while we've been able to discover so much, we can still do better. Let me give you an example. Imagine you were looking for something in the dark with a candle. You'd probably find it eventually, but wouldn't it be easier if you had 1,000,000 candles? The same is true for health research. The more data we have, the quicker we can find what we're looking for. Enter the All of Us research program. We want to help advance health research by creating a large health resource. How big? 1,000,000 people big. By having access to the data of 1,000,000 people, researchers can discover more about our health, and the possibilities really are endless. Here's where you come in. By sharing information about your lifestyle, environment, and biology, you can help empower the medical research of the future today.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better until now. Enter all of us. The research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Okay, we are back, and definitely at this point is you are going to conduct or just ask questions. It's no longer me asking these great fellows questions. And you know what? One thing that just stick with me throughout the whole thing. Yes, I know all of us concept in precision medicines or individualistic aspect of medicines are stay there. But I didn't know exactly if my big brother has jokes, right? One of the greatest researchers in Haiti, the person who have moved the world, and his name is Yo. Come on, I think we can do better than that. All right, so therefore, we have a lot of space just for questions. So please address your questions to either of them, either Dr. Dedier or Dr. Bonnet, but not me, because I'm a social scientist, I'm not in medicine. Why don't we start right now? Thank you, okay.
Hello. Okay, my name is Lucien. I'm a student with Dr. Bonnet now. So when we talk about reaching out to the community and everything, so I've seen Dr. Bonnet's practice, and you have a big practice in an underserved population. So I'm just wondering, what are we doing to reach out? Because I know you can reach out to so many of your patients. So how is the NIH is gonna help either your practice or any of the practices that in communities like this? How are they gonna help us to reach out to those patients? Because it's easier, we have those patients in the office and we can get them that way. So how are we gonna proceed that way?
So the question is probably for you, Didier.
Okay.
All right.
So, as I mentioned, but great question, thank you. As I mentioned before, and I think I'll remind the group, the All of Us research study has integrated community advisors at every level. And so Boston Medical Center is no different. We have our community advisory board. We also have an outreach board who has helped to organize this event actually as well. And so we rely on people like that who are from communities of color and diverse communities to advise us on the best ways to reach out. And so some of the things that Boston Medical Center has done is health fairs. We have reached out in different ways around needs that the community may have and trying to meet those community needs, such as health fairs and screenings, etc. So we work hand in hand with the development office as well and collaborate with them at Boston Medical Center. And so we've done a number of things and have other things planned as well. So as we interact with communities, we find out what the needs are, and we can think and brainstorm about other activities that we can do in communities that would be of value to communities and help us to get the word out too. So what I'm trying to say is that it's a collaborative effort with people in communities, always learning, always listening, and trying to meet needs as we publicize the All of Us research program.
Okay, next question.
Hi, my name is Dedier. One of the questions I have is, what does the process looks like in regards to being an active participant in the research process? What would be the expectation in terms of what is it that that person need to either do, or what would be engaging in?
Okay. So I will say that the research protocols for participants are evolving, and we at All of Us are continually devising new questions and new ways to gather information. But for the time being, at the present time, we're asking participants to enroll, and enrollment means answering several surveys about their health and having some physical measurements done, so their blood pressure is measured, their heart rate, things of that nature, and also to give us a sample of their urine and their blood that we bank for future tests, such as genetic tests and other biochemical tests. And then after that, there are periodic surveys that are sent out that we ask participants to complete and return to us. So they may come out, 3 months after enrollment, maybe several months after that, over the course of 5 or 10 years of participation, we hope, for each participant in this study. But researchers are continually thinking about new data that would be valuable to collect. And so that data may take the form of monitors, so sensors like Fitbits or things that actually monitor behavior, which we may mail out to participants to have them wear for a little while, or other tests that may arise. So it's constantly changing, if not increasing, over time. So I hope that answers your question.
My last question is, upon completion of the research, what is the goal in terms of the findings? What are we hoping to do with the findings? And I understand that the field of medicine is a highly political, field. And I think particularly for the African American community, we still do that whole trauma, from previous research that has been conducted in our communities. We still haven't really been able to enjoy or have any benefits from those past studies. So I think a lot of that trauma is still lingering, within the African American community. However, I truly agree that it is something that's significantly needed in regards to us having to participate in this research. So I guess my question is, what do we plan on doing with the findings about the research? Or is this something that we plan on going before the medical, board with it? Or is this information that we plan on presenting to pharmaceutical companies? And also, in terms of the service delivery process itself, how will the findings impact the future delivery in regards to the medicine? Like when I go to my PCP's office, will this finding, also will it impact, I guess, the PCP's ability to treat me more effectively? Will this increase a much more in-depth level of cultural awareness when it comes to dealing with a patient that looks like me?
Mm-hmm. Thank you for that question. So there's several questions there. I will start with your first one.
Can you summarize?
Can you summarize the question?
No problem.
Yeah, sure. So what I heard you ask is, what is planned for the data? Are there particular research findings that we anticipate or experiments that we anticipate doing? Number two, will the findings of this data, will the findings of the research be used to help providers, medical providers, to give better care. And you mentioned also the history of maybe distrust and communities of color not receiving results and benefiting from the research. So a very important distinction to make is that the All of Us research program is currently gathering information without having any particular research study in mind. There's no particular research question right now, but we know that the questions will come. If you're familiar with the Framingham Heart Study, for instance, this is a very famous heart study conducted in Framingham, Massachusetts. At the beginning of that study, they did the same thing. They gathered a lot of information about heart health, knowing that researchers would come after and ask questions of that data. So they would use the data, ask their own research questions, and then use the data to find answers. So we're in that phase right now of the All of Us research project. We're gathering a lot of information, expecting researchers to eventually ask questions of the data and use the data to do experiments and to find breakthroughs in medicine. So who will get to do that? Who will these researchers be? So I think All of Us is unique in that not only will NIH-funded researchers be allowed to access the data and ask questions and actually use the data, but whoever else wants to can too. There's this concept of citizen scientists. So people who are equipped to conduct the research, who may come from communities of color or who may partner with communities of color, can then conduct research on the data as well, provided that they get the clearances that are required to access the data. Industry can also get clearance to study the data and to ask questions and do experiments with the data. And so we're hoping that all of this research activity will lead to better treatments for patients, better ways to prevent disease, and better understanding of what causes disease in one person versus another.
Yeah, if I could add, there's two things which is very important. For those of us who've been here in the first program, we are fortunate to have a scientist from MGH as a black man. And today, you have Dr. Dedier. So at some point, we have some of us at the table in the decision-making process at the beginning. But let's say if you don't participate, now because they are zeroing on the individual, the same way we're talking at the beginning about medication being used, those has been researching on Caucasian and 82%. And post-marketing, they find out is not as effective on this one than that one, or the size effect could be bigger on this group versus that group. That is more specific. And at the contrary of what's happened in the past, yes, they would get the data, but that won't have, I would say, biologically, anything harmful to you. So we got a lot to gain by being part of the process. Because at the end, we'll be missing.
Okay, so therefore, I'm going to ask my audience, definitely, please just find ways just to be direct because of time. In the sense of time, I really want to see more. Go ahead.
My question is this. You're urging people to participate and understand. But do you have clinics, special clinics set up for that purpose? Or do people do it in the regular clinic?
That's good.
Primary care doctor. Or are there special places put together for that?
Very good question. So we are actively enrolling patients at Boston Medical Center and at a couple of community health centers affiliated with BMC. We intend to increase the number of community health centers where we enroll patients. So if you happen to get your care at Boston Medical Center, you can certainly enroll there. But there's now an opportunity for people who may not be patients at Boston Medical Center to enroll in the study. And these are called direct volunteers by the All of Us research program. And if one is able to download the app or go online or call the telephone number for the All of Us research program, one can find out where one can have the tests and all of the surveys, et cetera, done. The surveys can actually be done online, so you don't need to go anywhere to do that. But the measurements that we take and the samples that we request should be given at a designated site. So the vision is to have places like CVS and the community centers and other places be available for the testing that is required in person. So we have some sites already, and one would need to go online to find out where they are or call the number.
Okay, I believe we have more questions to ask. Okay, 1 and 2.
Hi, my name is Lynn, and I was just wondering, do you need insurance to participate in those studies? And also, if you could talk a little bit about PHI.
Okay, thank you. Very good question. You do not require insurance to participate in the All of Us research study. One does not actually need to be a U.S. citizen to participate in the All of Us research study. None of the tests that are done or run now or later on would be billed by insurance. So insurance is not a factor at all. Uninsured are encouraged to enroll as well. And the last part of your question was PHI. Yeah, so PHI stands for Protected Health Information. And what you're asking about is the security of the information that you give to the All of Us research study. So I can assure you that the highest levels of security are used to protect the information of people who enroll in the study. And these systems of security are constantly checked, and they are upgraded as we can possibly do that. But the highest levels of security that protect your social security number, let's say, and other information that you have given the government, those are the kinds of security systems in place to protect participants' data too. And when people analyze the data will be stripped of personal identifiers.
Oh, well, I do believe we have one more question. We have one more questions. Okay, so it seems that folks that the time is we are running out of time, and FX you still can and pose your question to these two giants, and at that point I can answer some questions for you, but not medicine. Thanks. Thank you so very much for participating. And this is a great endeavor, and I really want to see you again to this next initiatives. It's a great initiative because I see black people starting and research. Definitely, I do count on your coming, and because without you, we cannot run the show. Thank you so very much, and good night.
Next one is next Friday. Next Friday, that's the third one. The first one we did look at the value of research and barriers preventing ethnic minority to participate in research. Today we talk more about individualized medicine. We talk about some genetic and all those. But next one would be strategy to integrate ethnic minority into research. So in some of them we talk about that, but it will be more specific because the layers we have here is more a very, I would say, specific group. But if we are to really land to our community with all the deficit that they have, I think we need to add another different strategy to do so. So we'll talk about this, what we talk about next week. I hope all of you who's there could be there next Friday at the same time. I don't have no human word to say thank you to you.
Say, he is the big brother. He has the right. He can do whatever he wants. Thank you. Have a good night.